Hello, everyone. Today we will discuss the diagnosis and treatment plan for Olivia, presented by myself, Kevon Brown. First, we will go over Olivia's biopsychosocial. The biopsychosocial includes general background information about Olivia and her family history. Pictured here on the screen is Olivia, a 28-year-old Caucasian female who identifies as a bisexual woman. Her pronouns are she, her. Olivia's educational background includes a bachelor's degree in psychology, and currently she is pursuing a master's in clinical mental health counseling. Olivia works currently as a case manager for a local mental health organization in her community. Olivia is not married, however, she is in a relationship with her boyfriend, Ricardo. And Olivia's social economic status would fall under the lower middle class. So here's some information about Olivia's family. Olivia grew up in a traditional two-parent household consisting of a mother and a father. Olivia also has a younger brother named Oliver. Olivia's mom works as a school counselor, while her dad is employed at a large technical company as a manager. Olivia grew up in an upper middle class neighborhood. It is also important to note that Olivia's mom began experiencing high levels of anxiety when she was in high school, although she was not formally diagnosed with the disorder until she was 22 years old. Now we're going to get into some presenting problems that brought Olivia to counseling. Olivia stated that she has experienced restlessness. She has been easily fatigued. She has had some muscle tension. She's had difficulty concentrating, with her mind often going blank. She has been experiencing increased irritability because of her obligations with work and school and trying to balance relationships with her boyfriend and her family. Olivia has also been experiencing persistent worry. These symptoms have been occurring in Olivia's life for the past 8 months. Now we're going to get into some screening and assessment tools that have been used to assess Olivia's severity of Olivia's symptoms. First, we have the General Anxiety Disorder 7 scale, also known as the GAD-7 scale. The GAD-7 is a brief self-report questionnaire used to screen for generalized anxiety disorder and assesses the severity of its symptoms. It consists of 7 questions that ask about the frequency of specific anxiety symptoms over the past 2 weeks. Severity ranges from 0 to 3, with the highest total score possible being a 21. So the GAD-7 asks questions like, over the past 2 weeks, have you been feeling nervous, anxious, or on edge? Over the past 2 weeks, have you not been able to stop or control your worrying? Have you had trouble relaxing, worrying too much about different things? Just to name a few of the questions that are presented with the GAD-7 scale. Another scale that can be used is the Beck Anxiety Inventory, or BAI. The Beck Anxiety Inventory is a 21 item self report questionnaire designed to measure the severity of anxiety symptoms in adults and adolescents. The BAI aims to assess the frequency of anxiety symptoms over a 1 week period. Scores can range from 0 to 63. The BAI inventory asks questions such as um, have you, over the past week, had it been noticing yourself feeling hot? Have you been wobbly in your legs? Have you been unable to relax? Have you experienced fear of the worst happening? Have you been dizzy or lightheaded or feeling unsteady? Has your heart been palpitating or racing? Um, and so this is definitely a good scale to use when trying to assess for generalized anxiety disorder because when a client is experiencing anxiety, a lot of these symptoms are very common. And so the Beck Anxiety Inventory is a really good scale to use. The next um, assessment tool that can be used is the Hamilton Anxiety Rating Scale, or HAM-A. The Hamilton Anxiety Rating Scale is a clinician administered 14-item questionnaire designed to assess the severity of anxiety symptoms in individuals diagnosed with anxiety disorder. Scores can range from 0 to 30. And the HAM-A um, may ask, have you been experiencing an anxious mood? Have you had noticed any tension, any fears, any insomnia? Um, and it kind of just allows the clinician to score the client based off of, you know, conversation and asking these questions to determine if the client would benefit from the GAD-7, this not the GAD-7, the generalized anxiety disorder. So now we get into the diagnosis. So based on the presenting problems slash specifiers, it can be concluded that Olivia meets the requirements of generalized anxiety disorder. The American Psychological Association states in the DSM-5 TR that GAD is characterized by excessive anxiety and worry, apprehensive expectation, occurring more days than not for at least 6 months about a number of events or activities, such as school or work performance. So now we're going to get into the treatment plan for Olivia. So here is the treatment plan for generalized anxiety disorder. And so Olivia's problem is generalized anxiety disorder, um, as measured by, restlessness, muscle tension, sleep disturbances. These are all things that Olivia has been experiencing. So a long-term goal of Olivia, um, would be to um, reduce Olivia's symptoms of anxiety to a level that no longer disrupts her personal and professional life. This will be measured by a GAD score of 8 or lower at the time services are completed. A SMART goal would be Olivia will reduce her anxiety by 25% within the first 30 days of treatment. An objective would be Olivia will practice mindfulness exercises for 10 minutes daily to increase awareness of the persistent movement and reduce of the present moment, and reduce anxiety. An intervention would be to incorporate guided mindfulness exercises through apps or resources provided during sessions. Another objective would be Olivia will identify and challenge maladaptive thoughts, replacing them with balanced perspectives using cognitive restructuring techniques. And an intervention would be to utilize CBT worksheets, exercises, both in session and homework to practice cognitive restructuring. Now we're going to get into the treatment approaches. So, frequency and delivery of services. So, Olivia will attend a therapy session once a week for 60 minutes. This schedule can be adjusted to accommodate her symptoms related to generalized anxiety disorder. Olivia will attend in-person sessions, but telehealth options will be available depending on situational measures. So one form of therapy or one technique or approach that will be utilized in Olivia's case will be CBT. So in addressing Olivia's problem, I will focus on helping her reframe her thoughts surrounding uncertainty, particularly in both her professional and academic life. Her anxiety might stem from a fear of not meeting expectations or a lack of control over her future career path. Helping Olivia understand that uncertainty is a normal and unavoidable part of life can lessen its perceived threat. Now we get into comorbidity and addictive behaviors. So, generalized anxiety disorder can co-occur with other anxiety disorders, most commonly panic disorder. Also, generalized anxiety disorder can co-occur with mood disorders such as major depressive disorder. Now we talk about some addictive behaviors. So, at this time, there is no indication of a substance use disorder um, for Olivia. But through further sessions, this can be assessed more. Next, we get into the multicultural considerations. So, one major multicultural consideration um, to consider would be gender stereotyping in the workplace. We know that Olivia does work as a case manager, and she is a 28-year-old millennial female. And so she may face some stereotypes in the workplace surrounding the role of a woman. So now we get into three potential providers. So here we have Caroline. She has her LPC. I decided to include some areas of specialty that would align with Olivia. So Caroline specializes in anxiety, depression, and women's issues. This the location where she works is on the screen and her contact phone number. Next, we have Helen. She has her LCSW, and she also specializes in anxiety, depression, and women's issues. And then here we have Joseph, and he also specializes in anxiety, depression, and women's issues. And his contact information has been provided on the screen here as well. So now we get into a professional development opportunity. So on the screen, we have the dates for the professional development opportunity, which is July 8th through 12th. It's a 8-day um event that occurs in Costa Rica. Um, and this event here, they're talking about internal family systems, therapy, referral. They also will be doing a step-by-step strategies for treating clients who deal with trauma, anxiety, depression, and addiction. And I found this to be very helpful because, working in the mental health field, you are going to come across all kinds of clients that are going to deal with things from trauma to addiction to depression and anxiety. And in Olivia's case, we know that she has benefited from a diagnosis of anxiety. So this professional development opportunity would be very beneficial. And here we just have the cost. We have the times that the event will be taking place. We have the location. And we also have the customer service contact to inquire about attending the event. So that is all for the PowerPoint presentation. Thank you for sitting and listening.